Antimicrobial resistance is now present in every country in the world, with a fast-growing number of dangerous microorganisms no longer responding to any existing drugs. Multi-drug-resistant TB now infects 480,000 people each year. Drug resistance is also starting to complicate the fight against HIV and malaria. Without effective antibiotics, organ transplantation, chemotherapy, and even diabetes management become much riskier. One type of bacteria that commonly causes infections in hospitals is now so resistant even to last resort drugs that in some countries, treatment works in less than half the patients who need it. In the US, more than 23,000 people are dying each year as a direct result of antibiotic-resistant infections. All of this drives up healthcare costs. So how does AMR happen? The more often bacteria are exposed to antibiotics, the more opportunities they have to develop resistance. And we're exposing bacteria to antibiotics constantly. Antibiotics are vastly overprescribed. For example, even though they don't kill viruses, they're often administered for viral illnesses. Making matters worse, people often stop taking antibiotics when their symptoms improve, without finishing the full course. Ever hear the phrase, "what doesn't kill you makes you stronger"? That's what's happening here. Only it's deadly microbes that are getting stronger. The same goes for antibacterial soaps and cleaners. Large amounts of antibiotics are also in our meat. In the US, the livestock industry consumes more than 70% of all medically important antibiotics, which they use to promote growth and prevent, rather than treat, illness in the animals. This is cheap, but dangerous and unnecessary. After Denmark banned certain uses of antibiotics, farmers managed just fine by improving sanitation and ventilation and reducing overcrowding. Of course, pharmaceutical companies are partly to blame. They haven't been investing nearly enough in the discovery and development of new antimicrobial drugs. But what good are new drugs if the way we use them risks making them worthless? Before we had antimicrobial drugs, infectious diseases killed millions of people every year. Unless we address the causes of AMR, that past will before long be our future.